Well, hello and welcome once again to a discussion with Caldwell UNC Health Care. My name is Rocky Brooks and we're at Anderson Medical Park today. Cynthia Austin is our guest and we're at the Sleep Center. And we're going to be talking about the Sleep Center, educating you and me as well. Hey again, how are you?
Good, how are you doing? Welcome to the Sleep Center.
Thank you so much. I love your digs here.
Thank you. It's pretty nice. We like it.
I could see why. All right, Cindy, let's get started with it.
Very good.
Sleep studies,
Yes,
Sleep
sir.
Center.
Right.
Let's prepare for the day that someone arrives.
Okay.
If I'm coming in, what should I do to be prepared?
First of all, keep your day as normal as possible, okay? So just go about your day in the way that you would. If you get up and go to work, if you get up and go to school, whatever you do, try to keep it normal. You don't have to do anything. There's no prep for this.
Okay.
So,
It's time to arrive. What time should I be here? Earlier, late? Well, not late, but
right, not late.
Not
if you
late.
can,
Let's not be late. Okay.
Try to be here at 8 o'clock. That's what time we arrive patients and check them in.
PM.
8 o'clock p.m., yes,
Okay.
because you're going to be sleeping at night.
Okay.
And as far as when you arrive, just park out front. We do have access to the building. You'll just buzz and ring yourself in. We'll ask who you are and then bring you in.
All right. The study lasts how long, I guess, in preparation for what I can do later that evening or the next day? So what time can I leave?
Okay, so we generally wake our patients up at 6 o'clock a.m. in the morning. Feel free to bring clothes to go to work, go to school, whatever you need to do. And you're welcome, if you need to get up earlier than that, just ask your technologist and they can get you up prior to that if needed, as long as we're finished with the study.
Okay, you'll be able to see some photos of the rooms coming up. They're a full restroom, bathroom facility.
Yes,
so
absolutely.
I'm going to throw this in here. Cindy, is it okay if I take a shower, shave, get ready to go to work or whatever from here, or do I just need to pack up and leave?
No, absolutely. That's why we have the convenience of the showers. The rooms are very much like a hotel room when you come, when you check in. The rooms have nice beds, ceiling fans, TV. We have Wi-Fi, so if you need to get some work done or schoolwork done prior to going to bed, you're able to do that.
Okay.
Next morning when you get up, we have a full shower. We have hair dryers in the rooms.
Okay.
So you're pretty much set like you're checking into a hotel that night.
Okay, I like that.
Yeah.
So what should I bring, if anything, along with me?
Right, so bring any medications that you take at night with
Okay.
you, because we don't have medications here. Bring something comfortable to sleep in. A lot of people like to bring their own pillow. They're just comfortable with that. And if you're on CPAP, go ahead and bring the mask that you are using, just so that we can see what it is and what you're comfortable with.
All right. You mentioned about some hours the next morning, perhaps. Are all sleep studies the same? Will I be staying a full overnight?
Yes, sir. If you come to the Sleep Center, if that's what your doctor and your insurance decides is best for you, then when you come, you will be staying overnight.
Okay.
We do have to have a minimum of 6 hours of recording time, and that's from the time the study starts until the time the study ends. And then you can, as long as we're finished, then that's what we need.
All right. Again, I got to go back to the room.
Yes.
I like a firm mattress. It's
Okay.
just what I've gotten used to.
Right.
So describe the room. We will see some photos, but
Okay.
really the bed. Tell me about the bed itself.
Okay. All right. The bed is a very comfortable bed. As a matter of fact, we have a lot of people that want to know what kind of mattress is this. So it's a full-size bed, and all the same beds are in the rooms. Every room is private, so you don't have to worry about anyone else being in there other than your tech.
All right. I would be coming because I don't sleep well.
Right.
And can I bring something if I take something? Can someone bring something to take to help them sleep better? What's the situation with that?
Yes. Occasionally, the doctor will give something to help you sleep, but if you take something to help you sleep, whatever your normal routine is, go ahead and bring that medication. Sometimes people want to bring something over the counter, like a Tylenol PM or the Z's medicine for NyQuil. If you want to bring something like that, then that's more than okay for you to bring that.
Okay. That doesn't affect the results of the
Doesn't
study.
affect the results of the study, because bottom line, we need you to sleep.
Okay.
So to see what's going on with your sleep.
Even with those little enablers, you're still going to perform in your sleep the same way you always do.
Yes, one of the things that we're hoping to rule out is sleep apnea.
Okay.
And so when you come, if you're taking something of that nature, you're still going to have sleep apnea, or you aren't going to have sleep apnea. So, yeah, there are a lot of other things that we're looking for as well, like leg movements. We're looking to see if you have any biting or chewing or grinding, frequent restroom trips. So,
Okay.
still a lot of things that we're looking for, but when you have a sleep test, we're looking for you to sleep.
All right. Rumor has it that someone may have to cut their hair before they come in for a study because of how they're
Right.
hooked up. Is that true or not?
No, it's not true. You're not going to leave with little round spots on your head or anything. We do not have to shave anyone's head. Occasionally, if someone has a lot of hair on their legs or their chest, we may shave a little patch, but that's the only shaving that we're going to do, and with permission then. So
All right.
it's a fallacy. It's a rumor. So
Well, I've gotten over being self-aware, so to speak,
Okay.
which could be bad for my wife in public. However, with that being the case, I get the heebie-jeebies thinking somebody's watching me sleep. Is that true?
well, the technologists, all of our technologists are registered technologists, and no, we don't watch you sleep. Now, we do watch the electrical signals that are coming from your body with all of the sensors that we put on you, very similar to when you are having, when you see someone's heart, when you have the patches and you see the electrical signal of the heart, everything that we put on you is going to be showing as an electrical signal on our monitor. We do have a small picture of you on our screen because we are an accredited sleep facility. The doctor is able to go back and review that information if needed in order to make a final diagnosis. So your study is recorded, but the technologists do not sit there and look at you physically. They're looking at the electrical signal, which is your breathing, your heart rate. We're looking at what your oxygen saturation is, so those types of things.
I know you've seen all kinds of people come through. Some probably just fall asleep and
Right.
they're out, maybe, and there's no sleep apnea.
Right.
I move
Absolutely.
around at night a lot.
Right.
Would that be a problem with the results of a study if I had a study done?
It is not. So when people come, they say, do I have to sleep on my back? Do I have to sleep a certain way? We want you to be comfortable when you go to sleep. Okay, so moving, you're going to feel a little restricted at first, but just feel free to move. We do studies on pediatric patients as young as 12 years old, and they certainly move in the bed a lot sometimes. So moving is not going to interfere anything with the study. Just, once you get hooked up, feel free to sleep as normal.
I think that'd be a relief to a lot of people to know
Yes.
just that.
Yes.
Instead of them come in and be rigid when you have a tendency
You don't
to
have to be that. No.
Yeah. Okay. All right. Can someone come stay with me?
Well, if we are doing a study on a pediatric patient, then it's mandatory that a parent or legal guardian come.
Okay.
As far as other patients, if someone has a doctor's order for someone to stay with them, like if a patient is disabled, then of course we have a caregiver stay with them. Otherwise, we certainly invite the spouse or significant other to come, hang out in the room, ask questions of the tech about what's going to go on. But
Okay.
then when the study does start, they do have to leave because it is a medical test and we need to test that patient only.
Okay.
Okay.
I believe I understand
Right,
that in
right.
that regard. Okay. The results. When do the results come in? Are they pretty quick?
Well, usually patients are scheduled for about 2 weeks to see Dr. Burris for the follow-up, and he'll go over their study extensively and just talk to them about everything that occurred in their sleep. So about 2 weeks. If a patient doesn't see Dr. Burris for a follow-up, then their physician would have that information available in that same time period.
Okay.
Yeah, so pretty quick.
All right. And I guess back to it, the sleep study itself, is it a painful? Is it painless? Is there anything that might hurt at all?
The only thing that's going to hurt is in the morning when we have to pull those little patches off of you,
Okay.
and that's the worst that's going to hurt. I couldn't do this job if it hurt anyone, so nope.
Sleep apnea.
Yes, sir.
I know you've seen it. You know what it looks like and
Absolutely.
what the results can be.
Absolutely.
Tell us about sleep apnea and if
Okay.
there are any dangers associated with it.
Okay. Short and simple explanation is that sleep apnea is when you stop breathing for a period of 10 seconds. It's either because your airway is closing down or because your brain isn't telling you to breathe. So according to the U.S. Institute of Health, there are about 70 million Americans that have an untreated and treatable sleep disorder. So that's a lot of sleep disorders out there. And untreated sleep apnea can cause a rise in your blood pressure. It can cause cardiac arrhythmias. There are a lot of things, depression, lower life expectancy. So the list goes on and on and on as to, how dangerous sleep apnea can be if it is untreated.
All right, now you talk about not breathing or breathing properly when you're sleeping. When I'm asleep, I sleep soundly. My wife tells me I squirm around all the time. So I couldn't have sleep apnea because I'm asleep from the time my eyes close until I wake up the next morning.
Right. You hit on a key factor there. My wife tells me. So oftentimes it is because a bed partner does tell the individual something's going on. You stop breathing, you're holding your breath, you gasp, you snore. So those are definitely signals that you need to come in and have a sleep study. The bed partner, if someone down the hallway says you're rattling the walls, you're snoring, then that's an indication, that you need to come in as well.
It's so hard to believe that you don't know that you're snoring so loudly. And I did when I was younger.
Right.
Having tonsils removed solved that problem. People are amazed.
Right.
But it's amazing how well, even after just that,
Yes.
the amount of sleep, quality of sleep that one gets.
Right.
But I had no idea I was snoring.
Right. Well, and that the removing of the tonsils, that's another way that your airway is restricted. So there are a lot of different causes of what could be going on and underlying with, sleep. And we try to rule out sleep apnea, and that's our goal, is to rule it out. But there are a lot of underlying causes as to why sleep may not be quality sleep.
Okay. That's why I'm glad you guys are here,
Right.
and Dr. Burris as
Right.
well. You read the results.
Absolutely. Dr. Burris is wonderful, and again, he is looking for anything that may be disrupting your sleep or causing a lower quality of lifestyle.
During the sleep, Cindy, do you test for anything other than sleep apnea?
We do. We test for a lot of things, and again, it's anything that disrupts your sleep. So we are looking for leg movements that may disrupt your sleep. We're looking, do you have insomnia? Are you unable to get to sleep? Do you have frequent restroom visits? Is that interrupting your sleep? There's something called narcolepsy that is also something that we look at, and that mimics sleep apnea. So there are a lot of different things that we are looking at when someone comes for a sleep study.
All right. I know one of the things that helps people who have sleep apnea, because I have a friend who does,
Right.
and it's the mask.
The mask,
Cindy,
right.
I look at it and I think, if I'm claustrophobic, I'm not, but I still look at it and say,
Right.
I don't think I could sleep with that thing
Right,
on.
right.
How do people sleep with it?
Right, and we get that from almost everyone that comes in here, but the mask is not what it used to be. There are literally hundreds of different styles of masks on the market today. Everything from a mask that covers your nose and your mouth to a mask that's similar to a cannula that just sits at your nose, very lightweight. But in addition to the mask, there are various options available if you do qualify and if the doctor feels like it's something that would benefit you. There are oral devices also on the market. And again, that's something that Dr. Burris goes into very deep detail in speaking with you and what his recommendation is for you. But the masks have become much more tolerable.
Okay.
And when someone comes in and says, I don't think I can do that, by the time they leave the next morning, they are very thankful that they got a great night of rest. So,
If I'm on vacation,
Yes.
is it a tool you can take with you? Is it portable?
absolutely. It comes in a very nice overnight bag. You just throw everything in that one bag and take it with you. It's simple and easy, even if you're traveling on an airplane.
Okay.
Simple and easy. It's not counted as a carry-on either, so
Okay.
that's another good option. But absolutely, takes very little space. Just take it with you everywhere you go. You're going to miss it if you don't.
All right, my wife is a very slight woman in stature.
Right.
Would she be able to carry this with one hand, one arm walking through? I don't know what
Right.
the weight of this machine
It's going to
is.
be lighter than her purse.
Oh, it'd have to be. Really?
It's going to be lighter than her purse.
I'm gonna pay for that one.
Right, right. So it probably weighs anywhere from about 3 to 5 pounds, maybe.
Okay.
So very lightweight, just depending on what type of mask you're going to throw in there, and that includes your hose and everything.
Okay.
So,
All right.
Right.
Before I get to the last question, what have I not asked that you would like to let people know about?
Well, everyone comes thinking that we're going to do something that's going to hurt, or that they're going to be sleeping on an examining room table. Yeah. We make the sleep center very warm, very inviting from the time that you come. It's very private, like checking into your own hotel room. The privacy that oftentimes patients don't even know that there's anyone else here. Okay. They think that it's just them. Yeah. So it's we try to make it very low key, give them time to relax in their rooms, and then we start the study. And so just want people to know that you don't have to be afraid of it. We're not going to do anything that hurts, and our goal is to help you to have a better lifestyle.
Okay. We will show some pictures. You may have seen some throughout, but the room's pretty well equipped.
Yes, sir. Very large rooms. Very nice rooms. Every room also has its own temperature control.
Okay.
So a lot of people like to sleep in very cool. So whatever your temperature is, we'll set it for that, and you're good to go.
What about those who cannot go to sleep without some sound of some sort?
Right. So you can listen to music if you want to, if you have music on your phone. We also have sound machines. So again, we try to be very accommodating. We have earplugs for those that are used to earplugs. Okay. So, but the rooms are very quiet. So yeah.
And I noticed you have televisions in the room.
We do have televisions in the room, and you are able to watch TV as you're relaxing in the evening. So if you have a favorite program that you don't want to miss out on, then you're more than welcome to watch that, as long as it doesn't interfere with us, doing the part of the study that we need to do as far as the hookup and everything is concerned. Now, TVs do go off when the sleep study starts. So,
okay.
Right. It's a sleep study, not a TV study. So
I'm glad you mentioned that.
That's why we're here, for sleep.
I wondered. Okay.
Absolutely.
Because some people do. They say, "Oh, I have to have that TV on so I can go to sleep."
Absolutely. Absolutely.
That could be interfering with their sleep.
It could be interfering with their sleep, and there's something called blue light emission that comes from the TV, and not only that, but the sound going up and down throughout the night. So sometimes it's environmental factors that do affect sleep as well. Okay. So electronics off when the study starts, and that includes phone and tablets. All right. But until that time, you're welcome to use them.
And it's just for one night?
Just for one night, that's it.
Cindy, how do I schedule a sleep study?
Okay, so a couple of different ways to schedule a study. First of all, if you do have a primary care physician, then we urge you to speak with them, talk with them about your symptoms. Mm-hmm. The sleep center is local here. We're on the Pine Mountain Road at the Anderson Medical Center, just across from Hudson Middle School, so very convenient and located in the community. So talk to your physician and have them refer you here to Dr. Burris. Another way to schedule an appointment is, if you don't have a primary care physician, then you can call directly to the sleep center. The number is 828-757-8206, and you can make your own self-referral to Dr. Burris, and he'll be glad to sit down and talk with you. Plan on about an hour, and he will talk with you and we'll get you scheduled.
Wonderful. Cindy Austin, it's good to see you again.
It's good to see you.
Thank you for sharing your knowledge and your time with
Absolutely.
us. And folks, you have any questions, give that phone number a call. And we thank you for watching and being a part of what we're trying to do with Caldwell UNC Health Care and making your day a better one. Thank you.